Dear students, welcome back. In the previous session, we have seen the muscles crossing the elbow joint. Now, we are going to discuss about the muscle action around the elbow joint. So, to understand this muscle action well, you should know how this muscle is performing certain activity on the elbow joint. So to understand this concept well, so there are two ways of understanding of this muscle action. In that, the first one, what are the factors affecting the muscle activity on the elbow? And the next one is the patterns, that is the muscle activation patterns which causes movement on the elbow joint. You should understand these things in both the ways, then you can understand the muscle action well. So if you see the activation patterns, muscle activation patterns are nothing but the synergistic actions of these muscles. Okay, what are the synergistic patterns of the muscles which helps in the movement at the elbow joint? Okay, so the first way of understanding of this muscle action is the factors affecting the muscle activity. Okay, so what are the factors which are affecting the muscle activity, and how the role of this elbow muscles play in motion at the elbow by considering these factors. Okay, so how can you study all these factors means? So there is some studies to understand the information of the muscle action is through electromyography, that is EMG, and this technique is used to monitor the electrical activity that is produced by the firing of motor units. With electromyography, it is possible to determine the relative proportion of motor units that are firing in a particular muscle during a specific muscle contraction. And also in the muscle activation patterns of agonist and antagonist, as well as the synergistic activity among both agonists and antagonists, may be identified during the performance of different tasks. So this is the way of study to understand the or getting information about the muscle action by performing different tasks. Okay, so in this EMG we can understand the muscle action in both the ways. One is the factors affecting the muscle activity and also the activation patterns. Okay, so what are the how these factors affecting the elbow joint means? To understand those factors, mainly by the firing of motor units. So this firing of motor units will depend on these factors which are affecting the muscle activity. Okay, now what are the factors affecting the elbow muscle activities? Number one, number of joints crossed by the muscle. So if you take one muscle, how many joints it is crossed? So here is the brachialis. It is a one joint muscle. It is crossing only one joint. There are some other muscles which are crossing two joints, like biceps brachii and triceps brachii, which are crossing both the joints, one at the shoulder joint as well as the elbow joint. So the number of joints crossed by the muscle also affects the muscle activity. And the next one is the physiological cross-sectional area. So physiological cross-sectional area of the muscle and location in relation to the joint axis. So whether this muscle is the insertion of this muscle is located near the joint axis or away the joint axis. Based upon this origin and insertion to the joint axis or the which differentiate the muscles into shirt and spurt muscles, whether these muscles are mainly used for mobility or these muscles are used for stability. By the location of this muscle related to the joint axis, we can identify the muscle is mainly for mobility or the muscle is mainly for stability. Okay, so this is the third factor. What are the factors? First one is the number of joints crossed by the muscle, and the next one is the physiological cross-sectional area and the location in relation to the joint axis and position of the elbow. So this is the position of the elbow and adjacent joints. So how this elbow joint is related to the positions of the other joints, whether it may be a shoulder joint or a radioulnar joints. So this position of this elbow joint in related to the shoulder and radioulnar joints will also affect the muscle activity. Okay, now especially the position of the forearm. So whether the forearm is in supinated position or pronated position. If it is in supinated position, how the muscle activity is going to change? If it is in pronation, which muscle is going to be active and which muscles are going to be electrically silent? Such thing we can identify by the position of the forearm. Okay, and the magnitude of the applied load. So how much load is applied to this elbow joint and how these muscles which are crossing the elbow joint is going to react with the applied load, whether it become active or it become silent, and among these muscles which are crossing the elbow joint, which is going to be active when the load is applied. Okay, so this is the another factor. And the next factor is the type of muscle action. Type of muscle action. So in the types of muscle action, we'll get the concentric action, eccentric action, isometric action and isokinetic action. So during all these actions, how these muscles are going to affect and how the muscle activity on the elbow joint is occurring, we can understand by the type of muscle action. And then next one is the speed of motion, whether this action is taking place slow or fast. Okay, so whether the muscle is contracting slow or fast based upon the speed of motion also, the muscle activity is going to be affected. And coming to the momentum, so this momentum is changing at different positions. That means different degrees of range of motion, this momentum is going to change. So this also affect the muscle activity. And the fiber types, the type of fibers which are present in the muscles. So all these factors affecting the muscle activity. Okay, what are the factors affecting the elbow muscle activity? The first one is the number of joints crossed by the muscle, whether it is one joint or two joint. And next one is the physiological cross-sectional area. Third one is the location in relation to the joint axis, the muscle here, the muscle, how the muscle is located in relation to the joint axis, and also the position of elbow and the adjacent joints, especially the position of the forearm. And the sixth one is the magnitude of the applied load and the type of muscle action, whether it is concentric, eccentric, isometric or isokinetic, and also the speed of motion, whether the movement is taking place slow or fast. And next one is the moment arm at different joint positions will have different actions of that muscle. That means if the momentum is increased, it is having more translatory, more rotatory than translatory. If the moment arm is less, it is having more translatory than rotatory. So if the translatory component is increased, there is a compression over the joint or distraction of the joint. Whereas if the rotatory component is increased, the range of motion, the rotatory movement of the elbow joint is increased. Okay, so and the next one is the fiber types, whether it is a slow oxidative fibers, isn't it? So or whether it is having yellow fibers or white fibers, how it is going to be affected. So based upon the fiber types, also the muscle activity is going to be depend. But as coming to the synergistic or this muscle activation patterns, so the muscle activation patterns of agonists and antagonists, as well as the synergistic activity among both agonists and antagonists. So what are the factors affecting such kind of muscle activation patterns? Or in this, the factors affecting are, again, it depends on number of joints crossed and type of, so number of joints crossed means, so whether it is going to be actively insufficient or passively insufficient, we can find out whether the muscles are crossing more than one joint. Okay, and next one is the type of muscle action. So the activation patterns also depends upon the type of action and speed of motion and the resistance, that is the applied load, and also this activation patterns depends upon the requirements of the task. So if you want to lift a book from a table and you have to put on another table, so based upon the task also the muscle activation patterns. So you may sit and do it this activity, or you may stand and do it this activity, and you may be far away from that table and you may be near to that table. So but the activity is same, but the position of your elbow is different in different positions. So how the muscle is going to be muscle activation patterns are going to be changed in different situations. That thing is called as requirements of the task. Now, and also the direction of stress and activity of other muscles. So direction of stress means, so in which direction the elbow is moving, then based upon that direction the muscle activation patterns are going to be changed. Okay, so both the requirements and the direction of the stress are more or less related to each other. Okay, and also the activity of other muscles. During performing this action, some other muscles are also going to be activated. So you have to consider the activity of other muscles also to understand the muscle activation patterns. So these are all the factors which are going to be affect the muscle activity. Okay, now the first one we are going to see is the elbow flexors, and we are going to apply all these factors affecting the elbow muscle activity, not the activation patterns. The first one we are going to apply is the factors affecting the elbow muscle activity. Okay, what are the elbow flexors? The brachialis, biceps brachii, and the brachioradialis are the major elbow flexors, isn't it? Yes. Now, in the elbow flexors, first we are going to consider the brachialis muscle. Here comes the brachialis. So the brachialis originating from the anterior surface of the lower end of the shaft, lower half of the shaft, and which is going to be inserted on the ulna and the coronoid process. That is the ulnar tuberosity and the coronoid process. So this is the attachment of the brachialis muscle, and this is the moment arm of the brachialis at 100 degrees of elbow flexion. Okay, so this brachialis is considered as mobility muscle because its insertion is close to the elbow joint. Okay, so if the insertion is closer to the elbow joint, then it is classified as the mobility muscle. And this is also having large strength potential because it is having large physiological cross-sectional area and also large work capacity, and it is also having greater volume as well as the physiological cross-sectional area. And the momentum of the brachialis is maximum, that is greatest, at slightly more than 100 degrees of elbow flexion. Okay, next, because the brachialis is inserted on the ulna, so it is inserted on the ulna because of the position, the brachialis which is inserted on the ulna, it is unaffected by the changes of the forearm positions which are brought about by the rotation of the radius. We have seen that the two other muscles, which is biceps brachii and the brachioradialis are going to attach on the radius. So these two muscles will have some effect during the position of the forearm, but the brachialis doesn't have any effect during the changes of the forearm position because it is inserted on the ulna. Okay, so and also being a one joint muscle, that means it is crossing one joint, it is not affected by the position of the shoulder also. Okay, according to the EMG studies, the brachialis muscle works in flexion of the elbow in all positions of the forearm with and without resistance. It also active in all types of contractions like isometric, concentric and eccentric during slow as well as fast motions. Okay, and the fact that the brachialis works in all conditions may be related to the finding that the CNS appears to favor using one joint muscles over two joint muscles to perform an isometric activity. So what are the factors we have seen are all implied here to understand the elbow flexors, and we have applied all factors on the brachialis muscle to understand the function of the brachialis muscle. Next comes to the biceps brachii. Like the brachialis, this biceps brachii is also considered to be the mobility muscle because of its insertion close to the elbow joint axis. Okay, here the long head of biceps brachii has the largest volume among the flexors, but the muscle has relatively small physiological cross-sectional area. Okay, the moment arm of the biceps is largest between 80 to 100 degrees of elbow flexion. Here you can see the moment arms are at 0 degrees and at 85, 90 and 100 degrees. So in between these three ranges of elbow flexion, the moment arm is maximum. Okay, and the biceps is capable of producing its greatest torque in this range. The momentum of the biceps is rather small when the elbow is in full extension, and most of the muscle is translatory and towards the joint compression. So in this 0 degrees of elbow flexion, so the moment arm is very small and it is having the muscle force is acting as a translatory and towards the joint compression. So here the force is acting towards the joint, so it creates some compression in the joint. Okay, and therefore the biceps is less effective as an elbow flexor when the elbow is full extended. That means when the elbow is full extended, it is less effective as an elbow flexor. And then when the elbow is flexed to 90 degrees. When the elbow is flexed to 90 degrees, it is having capable of producing greatest torque in this range, and here it acts as a powerful flexor of the elbow here. Okay. When the elbow is flexed beyond 100 degrees, the translatory component of the muscle force is directed away from the elbow joint, and Therefore, it acts as a distracting or dislocating force. So here beyond 100 degrees, what will happen? Beyond 100 degrees of elbow flexion, the translatory force which is present, which are produced by the biceps, is acting away from the joint, which is causing distraction or dislocating force. Okay. The functioning of the biceps is affected by the position of the shoulder. Whereas the brachialis, it is not affected by the shoulder because it is a one joint muscle. But the biceps is having both the heads, out of which the long head of biceps is crossing both the shoulder and the elbow joint. So the position of the shoulder also affecting the function of the biceps here. Okay, in full flexion of the elbow is attempted with the shoulder in full flexion. So both shoulder flexion as well as the elbow flexion simultaneously occurred, especially when the forearm is supinated. The muscle ability to generate torque is diminished. So simultaneous action of shoulder flexion as well as the elbow flexion, that is full flexions of both elbow and the shoulders, especially when the forearm is supinated. In that position, the ability of the biceps muscle to generate torque is diminished. Okay. And the activation of biceps was found to be significantly affected by elbow joint. So joint angle, that is the carrying angle. So the biceps action is also affected by the elbow joint angle during concentric and isometric contractions only, but not in isokinetic and eccentric contraction. So the activation of the biceps was also found to be significantly affected by elbow joint angle during the concentric type of contraction and isometric type of contraction, but not during eccentric or isokinetic type of contractions. And also some EMG studies of the flexors and extensors, the biceps brachii was active for supination torques. They have found that the biceps brachii was active for supination torques. Some studies on subjects by Nascio and associates were asked to maintain the elbow in flexion. So that means they have studied in one position that the person has to maintain the elbow in flexion while performing alternating motions of supination and pronation at low and fast speeds. So that means one study that the elbow has to maintain in flexion while performing alternating motions of supination and pronation at slow and fast speeds. Then they have found that the EMG activity increased in the biceps during slow supination and decreased during pronation. That means the biceps is active for supination torques. So biceps is having both the action, that is supination as well as the flexion at the elbow joint, especially that supination action is mainly at 90 degrees or 85 to 100 degrees range of flexion. Okay. The biceps brachii is active during unresisted elbow flexion with the forearm supinated and when the forearm is semi-prone position. Okay. When the forearm is in semi-prone position, in both concentric and eccentric contractions, in such position, the forearm is active towards the supination, but it is not tend to be active in pronation. So that means the biceps brachii is active during unresisted elbow flexion with the forearm supinated. Okay, that is the one of the function of the biceps. And when the forearm is midway between the supination and pronation, that is the mid-prone position, in both concentric and eccentric type of contractions, the muscle is tend to be active when the forearm is pronated. Okay, a forearm is supinated but not in pronation. Okay, so this is the function of the biceps brachii. However, when the magnitude of the resistance increases, that means the speed of motion along with resistance increases much beyond the limb weight, then in such kind of position, the biceps is active in all positions of the forearm, whether it may be supination or pronation. In those positions, when the resistance and the magnitude is increased beyond the limb weight, then the biceps is active in all positions of the forearm. Normally in unresisted positions, the biceps brachii is active during forearm flexion and supinated position. Okay, but in resisted and speed of the movement increases and the resistance is beyond the limb weight, then the biceps is active in all positions of the forearm, that is both in supination as well as the pronation. And some studies have found that the momentums of all major supinators exhibit peak values. So the supinators produce peak values in the range of 40 degrees to 50 degrees of pronation. The biceps brachii and the supinator act as supinators through the entire range of forearm rotation. So through the entire range of rotation, that is from supination to pronation and pronation to supination, the biceps acts as a supinator along with supinators through the entire range of forearm rotation. That means during pronation it becomes electrically silent, and when the supination starts, the biceps brachii along with supinator functions together to the entire range of forearm rotation. Okay, this is about the biceps brachii function. And coming to the brachioradialis, so as we know that this brachioradialis is originating from the lateral supracondylar ridge, and it is getting inserted at the distal end of the radius, just proximal to the radial tuberosity. That means the muscle is present like this, isn't it? So this is the brachioradialis muscle. Okay, if you see the forces which are created by this muscle, if you resolve these forces of this brachioradialis, we find that it is having more translatory than the rotatory component. Okay, so if you can see, if you resolve the forces, so this becomes the rotatory and this becomes the translatory force. Okay, that means for the brachioradialis, it is having more translatory than the rotatory. So this is the muscle action line. So if you resolve this forces, it is having a rotatory, less rotatory and greater translatory motion. And if you see the insertion of this brachioradialis, the brachioradialis is inserted at a distance from the joint axis. Therefore, it is said to be the stability muscle than the mobility muscle. Okay, because of this far away insertion to the joint axis, and this becomes the total muscular force. This is the total muscular force. And when we resolve this into rotatory and translatory, it is having greater translatory component which compresses the joint here and helps in the stability. Okay, the brachioradialis has a relatively small mean physiological cross-sectional area about 1.2 centimeters, but it is having a relatively large average peak momentum in comparison with the other elbow flexors. Okay, and the peak momentum of the brachioradialis occurs between 100 to 120 degrees of elbow flexion. When the elbow flexion is at 100 to 120 degrees, that means here like this. So then if you see the muscle action, so the brachioradialis will come like this here. So the brachioradialis and this. And then if you see the forces here, so it is having greater momentum at this position than the translatory. Okay, so it is showing greater peak momentums than the other two muscles, that is the biceps brachii and the brachialis muscle. Okay, next, this brachioradialis does not cross the shoulder and therefore it is not affected by the position of the shoulder, and it is therefore unaffected by the position of shoulder. The position of the elbow joint was found to affect brachioradialis muscle activity only during voluntary maximum eccentric contraction. So during voluntary maximum eccentric contraction only, that means, so if the eccentric contraction takes place during extension of this elbow joint, in that condition only the brachioradialis muscle activity is going to change. And the elbow joint angle had no effect on concentric, isometric or isokinetic maximum voluntary contractions. Here the position of the shoulder doesn't have any effect on this brachioradialis, and also the elbow joint angle also doesn't have any effect on the brachioradialis muscle. Okay, and the brachioradialis shows no electrical activity during eccentric flexor activity when the motion is performed slowly with the forearm supinated. Okay, and the brachioradialis shows no activity during slow unresisted concentric elbow flexion also. When the speed of the motion is increased, the brachioradialis shows moderate activity. If a load is applied and the forearm is either in position midway between the supination and pronation or in full pronation. So the speed of the motion is increased when the brachioradialis shows moderate activity if the load is applied and the forearm is in mid-prone position or in full pronation. Okay, and also higher levels of activity were noted when the forearm was pronated than when it was supinated. Okay, and these are all the muscle actions of the brachioradialis on the elbow joint. And coming to the extensors here, in the extensors, so the effectiveness of the triceps brachii as a whole is affected by the changes in the position of the elbow and also changes in the position of the elbow, but not in the changes in the position of the forearm. Whether it may be supination or pronation, it will not change the effectiveness of the triceps. Okay, because the triceps attaches to the ulna, not to radius. So for that reason, the triceps will not affected by the position of the forearm. Okay. Activity of the long head of triceps is affected. So this long head of triceps is crossing both the shoulder joint as well as the elbow joint. So it is affected by the position of the shoulder as well as the elbow. The long head's ability to produce torque may diminish when full elbow extension is attempted with the shoulder is hyperextension. That means simultaneously when full elbow extension as well as the shoulder hyperextension occurs, then the muscle activity of the long head of triceps is diminished. Okay, because the muscle is going to be shortened more in that position. The medial and lateral heads of the triceps being one joint muscles, isn't it? So from the humerus above the radial groove and below the radial groove, these two heads are getting arising and which is getting inserted on the olecranian process. So these two heads will not affected by the position of the shoulder, but it is affected by the position of the elbow. Okay, the medial head is active in unresisted active elbow extension, but all three heads are active when heavy resistance is given to extension or when quick extension of the elbow is attempted in the gravity assisted positions. So here, because of its crossing of one joint muscles, so these are not affected by the position of the shoulder, and the medial head, out of these two heads, the medial head is active in unresisted active elbow extension, but when all the three heads are active, when heavy resistance is given to the extension or when quick extension of the elbow is attempted in the gravity assisted positions. In these two positions, all the three heads are going to be active. Okay, and maximum isometric torque is generated by this triceps muscle when the elbow is flexed at 90 degrees. Okay, and the triceps is active eccentrically to control the elbow flexion. So to control the elbow flexion, the triceps muscle is functioning eccentrically. Okay. So you can see this is the push-ups here. Here the elbow is flexed here, and during this elbow flexion, the triceps is acting eccentrically here. The triceps is acting eccentrically to maintain the elbow flexion when the body is lowered to the ground. Here the body is lowered to the ground in a push-up. And when the triceps is active concentrically, here the triceps is acting concentrically when the elbow, concentrically when the elbow is extended and the body is coming away from the ground during the push-up action. Okay, so these two positions and these two functions are taking place in a closed kinematic chain. Okay, the triceps may be active during activities requiring stabilization of the elbow and also helps in the extension of the elbow. So it is having both functions. And this triceps is also acts as a synergist to prevent flexion of the elbow when the biceps is acting as supinator. And the other extensors of the elbow, that is the anconeus, assist in the elbow extension and or apparently acts as a stabilizer during supination and pronation. Mainly the triceps is acting as a stabilizer as well as the extensor at the elbow joint. And in a closed kinematic chain, the triceps acts as eccentric contraction when the elbow is flexed, when it is in having concentric contraction when the elbow is extended here. Okay, and it also acts as a synergist to prevent flexion of the elbow when the biceps is acting as supinator. And coming to this anconeus assists in the elbow extension and also acts as a stabilizer during supination and pronation of the forearm. And these are all the muscle function of the elbow joint and what are the factors affecting the muscle activity around the elbow joint. Okay, so these are all about the muscle activity of the elbow joint. Thank you.